U.S. Democratic Senator Bernie Sanders has ended his presidential campaign. Jamaica extends its nightly curfew to combat the spread of the COVID-19 pandemic. And a new field hospital opens in London as the United Kingdom registers about 56,000 COVID-19 cases. Hello and welcome to Telesur. I'm Carla Gonzalez in Quito, and this is from the South. In the United States, Vermont Senator Bernie Sanders has ended his presidential campaign, making Joe Biden the main frontrunner to challenge President Donald Trump for the presidency in November. Sanders broke the news to his staff on Wednesday. The announcement follows Tuesday's primary held in Wisconsin amid stay-at-home orders to curb the spread of the novel coronavirus. The results have not yet been announced. U.S. President Donald Trump has threatened to stop funding the World Health Organization, accusing it of bias towards China and missing the mark on the COVID-19 pandemic. He claimed the UN body's biggest source of funding was the United States, but according to the WHO, Washington provided 14.67% of its funding in 2018-2019.
They called it wrong. They called it wrong. They missed the call. They could have called it months earlier. They would have known. And they should have known. And they probably did know. So we'll be looking into that very carefully. And we're going to put a hold on money spent to the WHO. We're going to put a very powerful hold on it. And we're going to see. It's a great thing if it works. But when they call every shot wrong, that's no good.
Jamaica's Prime Minister Andrew Holness has announced that the government will be extending the nightly curfew implemented to fight COVID-19 on the island. The measure started on April 1st and was expected to end on April 8th. It prevented the movement of non-essential persons between the hours of 8 p.m. and 6 a.m. The Prime Minister also said that other restrictions currently in place to address the pandemic, including working from home and the closure of all borders, will also be extended. Jamaica has 63 confirmed cases and 3 deaths related to the virus.
This money is not free money.
Antigua and Barbuda has registered its second death from the COVID-19. In a Facebook post, Prime Minister Gaston Brown expressed that while the victims had pre-existing conditions, all are at risk of contracting the disease. He further called on the public to strictly observe existing protocols, including practicing personal hygiene, social distancing, staying at home, and quarantining as appropriate. Trinidad and Tobago has recorded 107 COVID-19 cases and 8 deaths as the government continues to ramp up efforts to fight the virus. Warning citizens that the pathogen is evolving, the health minister pleaded with the public to stay at home.
Anybody who is outside of their homes, not on essential business, you are the pinnacle of a pyramid of infection. You will infect 2 people, then 2 will infect 6, then 6 will infect 10, and then all those 10 persons start up their own pyramid, and you get this explosion in cases. And that is what we are trying to avoid with these stay-home orders.
Cuba is working with the government of Trinidad and Tobago to send a team of medical professionals to assist the country in its fight against COVID-19.
The Cuban government is making the necessary arrangements to have a Cuban plane bring these nurses here, and those arrangements are currently being put in place, and I hope that we will be able to complete it and get these Cuban nurses here, medical personnel here within the next couple of days. They will be quarantined for the 14-day period, and once at the end of that 14-day period they're healthy and have not shown any signs or been positive for COVID-19, they will then be allowed to enter our healthcare system.
Venezuelan President Nicolás Maduro has announced the arrival of humanitarian aid shipments from Russia, the Pan American Health Organization, and UNICEF to help in the fight against the COVID-19 pandemic.
I want to announce that on Wednesday, April 8th, a special humanitarian shipment will arrive in Venezuela. Aid coming from the Pan American Health Organization, UNICEF, and the Russian Federation will support our own efforts, as they have donated medical and protective equipment, as well as ventilators and testing kits. Presidential officials and the foreign minister will receive this shipment.
President Maduro also announced an upcoming video conference with the OPEC coalition to establish a consensus of fair prices for the hydrocarbons to help restart the global economy.
Through all ministers, Major General Manuel Quevedo, and also the Vice President and the Foreign Minister, I have been in contact with the governments of Russia, Saudi Arabia, and all other partners of OPEC to arrange a video conference next Tuesday, on April 9, where we will be trying to reach consensus for the revival of the global economy.
Venezuelan Vice President Delcy Rodriguez said that migrants who return to the country will be guaranteed food, accommodation, and free medical assistance in the midst of the pandemic.
We have had in recent days a significant influx of Venezuelans returning home because of xenophobic attacks and discrimination, of rejection by the governments that make up the Lima cartel. We are welcoming them with very strict health. A mandatory 2 weeks quarantine is also being enforced. All returning citizens are treated and immediately tested for rapid detection of COVID-19. They are also guaranteed for free food, free accommodation, and free medical care.
We're taking a short break now. Don't go away. Welcome back. More news at this hour. Ecuador's top court has convicted former President Rafael Correa of corruption charges and sentenced him to 8 years in prison. Correa was among 20 people, including his vice president Jorge Glass, accused of accepting $8 million in bribes in exchange for public contracts between 2012 and 2016. The court also banned Correa from politics for 25 years. And after that, Correa heavily denied the charges, saying the situation was a political witch hunt. Correa has been living in Belgium since 2017, and Ecuadorian authorities are not expected to request his extradition until the case has made its way through the anticipated appeals process.
In the midst of this emergency, they took time to hold illegal and irregular hearings. Everyone knows that the hurry is to take me out in time for the next elections. We shouldn't have any faith in the Ecuadorian justice system, which is totally controlled by the government, by the powers, by the media. On the international stage, we are going to generate everything because this case is a joke. There are no bribes. The main and almost only evidence is a notebook that was clearly forged. But it's an outrage that in this emergency they are using judges, lawyers, journalists to continue with their hateful political plan.
As the coronavirus crisis continues in Ecuador, citizens say authorities are still failing to pick up the bodies of those who have died in their homes. Officials have announced that around 40% of health workers have tested positive for COVID-19.
The streets of Guayaquil are the site of numerous heart-wrenching stories, tales of those who have been left to die after the collapse of the city's health system, and whose bodies are abandoned by authorities.
This is my mother's house. We're here because we can no longer stand the smell of the body. Nobody is helping us. Nobody has come to pick up my grandfather's body. I don't know where to go to find help. Where is the government when we need them?
Campesinos in Guayas province have started to organize for the possibility of a food shortage.
Providers are saying they don't want to go to Guayas anymore out of fear of getting infected. That is why the Campesino movement in Guayas has set up special brigades to pick up product that was discarded on the fields because we cannot let anything go to waste now.
Recently, due to political disagreements, the National Assembly blocked the approval of a new health code. For lawmaker Ángel Sin Maleza, one of the main mistakes made by this administration was laying off hundreds of doctors.
The layoffs started last year, and authorities were warned that this was a mistake, especially getting rid of people in the epidemiology department and those in the research institute. We had asked the previous health minister to talk to the government to put a stop to the layoffs. Now we're all paying for those mistakes.
On the top of this, authorities announced that around 40% of health workers have been infected by COVID-19.
We have over 1,600 cases of health workers who have tested positive for the novel coronavirus. This is worrying because they have to go under quarantine before going back to work.
Authorities have provided citizens with new ways to ask for the removal of the victims' bodies, but people say that these are not working. Guayaquil's City Council announced they would donate over 1,000 cardboard coffins for the deceased.
A shipment of medical aid from China has arrived in Mexico City as part of the government's plan to bring in personal protection equipment for hospitals in Mexico. According to the Deputy Health Secretary Hugo Lopez, the shipment mostly includes hazmat suits, surgical masks, and N95 masks. He also said Mexico is expecting more of this kind of shipments from China. Uruguayan authorities have authorized a humanitarian flight to evacuate 100 passengers of the Greg Mortimer cruise ship. The passengers will be flown back to Australia as the cruise ship has over 128 positive cases of COVID-19.
Over 100 Australian and New Zealand passengers are to be evacuated back to Australia, with the remaining passengers and crew staying on the ship in quarantine. Most of those who will remain on the ship are crew members. The crew are much younger in age than the passengers, so those we will be evacuating are the older people who are more at risk. The crew have an average age of 40 years.
Hundreds of Bolivians living in Chile have been blocked from entering the country as borders between both nations have closed amid the COVID-19 pandemic. The migrants were met with repression from Bolivian security forces who denied them access to their homeland on Tuesday. According to preliminary reports, the violence left one wounded from each side.
I want to take this opportunity to ask once again that the authorities of Talabacan take action to prevent these types of clashes in Colchanes. In addition, food insecurity affects hundreds of Bolivian citizens since stores are closed. We don't have enough goods. The demand surpasses our capability as a municipality.
In Bolivia, the campesino unions of the Chapare region, part of the support base of the movement towards socialism, are delivering a donation of 16 truckloads of produce to the city of Cochabamba. That donation will go to people in need amid the crisis and will include bananas, oranges, tangerines, pineapples, and other produce. Since the start of the quarantine, families have been without the means to make a living in the absence of their day-to-day work. The food will be distributed free of charge to areas including the Zona Sud and other localities which have requested assistance. In other news, indigenous people in Colombia are often forcibly displaced from their homes due to internal violence. Now they are taking the necessary measures to stop the spread of the novel coronavirus without any help from the government.
People from the Embera community who arrived to Bogota after being forcibly displaced from their lands say they are now being removed from the places that housed them due to a lack of resources during the mandatory quarantine.
I've been here for about 3 months paying rent, but now they demand we pay every day. But we cannot work at this time, so they kicked us out this morning.
Many of the families live day by day, and they survive by making and selling handcrafts. But with the situation, we must all stay home, which hasn't been easy for them. And the state hasn't guaranteed anything for the people. The people like these people who live day by day and who could use any aid.
This situation paints a worrying picture for indigenous people in Colombia as they face multiple threats. In their lands, they must live under constant violence and now fight an invisible enemy, the novel coronavirus.
For the nomad people of Orinoquia, there is no attention. The nomad and sedentary people of the Pacific are confined in urban areas because rural areas have been vetoed. We can't hunt or fish, so where can we get the food that we need to live?
In the face of the state's disinterest, the indigenous communities have been implementing preventive measures of their own to slow down the arrival of the pandemic, but they say armed groups and even public security forces are preventing their work.
We asked them to stop blocking our measures. We're trying to face the situation with absolutely no help from the state.
Until now, indigenous communities have only reported 2 confirmed cases of COVID-19, both within the Yucpac community.
We have more stories coming up. Stay with us. Thank you for joining us again. Iran has urged the International Monetary Fund to approve a $5 billion emergency loan to combat the COVID-19 pandemic. Iran said last month that it had requested a loan from the IMF, as it is among the most affected countries in the world.
I urge all international organizations to fulfill their duties during this condition. We are a member of the IMF, a member of the World Bank. We are paying for our membership. A part of our reserves are at their disposal. It will be written down in history that the White House, which was engaged in economic terrorism so far, is now a terrorist in health issues too. This will remain as a historical shame for America's leadership.
China has ended its lockdown of Wuhan, the city where the coronavirus first emerged. After 11 weeks, authorities will allow the city's 11 million residents to once again travel in and out of Wuhan. However, residents will be required to keep using a smartphone application that monitors their health status and shows that they have not been in recent contact with anyone confirmed to have the virus. Across Wuhan, nearly 94% of businesses have reopened, but schools remain closed for now. Wuhan's international airport has also reopened. Among the first passengers were a group of medical workers who were able to fly home after joining the front line in combating the outbreak in the city. Other passengers also included those who were stuck in Wuhan after visiting their families for the Lunar New Year. As life slowly returns to the streets of Wuhan, China's National Health Commission confirmed 62 new cases of COVID-19 and also 137 asymptomatic infections. None of the new cases were reported in Hubei province, the epicenter of the outbreak, and most of them were imported from abroad.
There are 62 newly confirmed cases, of which 59 cases are imported from abroad, 25 cases in Shanxi, 25 cases in Heilongjiang, 5 cases in Shanghai, 2 cases in Guangdong, 1 case in Beijing, and 1 case in Zhejiang. 3 cases are domestic cases, in which 2 cases in Shandong and 1 case in Guangdong. There are 2 new deaths, 1 in Shanghai and 1 in Hubei.
A new field hospital has opened in London as the United Kingdom registers about 56,000 COVID-19 cases and over 6,000 deaths. The NHS Nightingale Hospital was built in the Excel Convention Centre and is able to house around 4,000 patients. A second NHS Nightingale Hospital, which has been built at the National Exhibition Centre in Birmingham, is to be open on Friday. It would initially have 500 beds with the capacity to expand to 2,000. A Romanian medical team has arrived in northern Italy to assist local hospitals in combating the COVID-19 pandemic. Although pressure on intensive care wards has somewhat eased in the past few days, Italy remains the hardest hit country in the world, with more than 17,000 deaths reported on Wednesday. The European Commission announced that aside from the Romanian team, a group of doctors will also arrive from Norway to help treat coronavirus patients. And Spain has recorded 757 deaths in 24 hours, bringing the total figure to more than 14,000.
The cumulative number of cases as of Tuesday afternoon is 146,690, representing a total of 6,180 new positives. And based on this data, we continue to see a 4% increase in daily figures. As it relates to the death toll, 14,555 people have died in total, with 757 fatalities in 24 hours. Another important statistic to note is that more than 48,000 people have been discharged.
And with those figures, Spain remains one of the most affected nations by the novel coronavirus, with hospitals in Barcelona taking a significant toll. Let's take a look.
Like many other hospitals across Spain, work here is intense, and many spaces are being rearranged to aid in the fight against COVID-19.
We have transformed some special units to help patients who need more dedicated care than what we are used to offer.
Spaces have also been repurposed to expand the intense care unit.
Hospitalization units are being repurposed, and we have created new intensive care units for patients who need to be intubated and depend on a ventilator.
For mild cases, this hospital has also taken over a hotel with a capacity for 500 people. Across the nation, a number of public and private spaces are being used to treat patients. One of those most affected have been health workers, as many are testing positive for the coronavirus. On top of this, there are shortages of supplies in many hospitals.
Individual protective equipment is running out quickly. There are problems with the resupply. We are overusing equipment and sometimes even sharing it.
Another issue is providing psychiatric help to patients and their families. But the government of Catalonia has started to work on a system to connect people who have been affected by the disease.
Patients are going through a very difficult situation because they cannot receive any visits and don't know what could happen to them. Their families are suffering from the same uncertainty and that feeling of helplessness. There's a lot of anxiety among them.
It is key to figure out a way for patients and their families to communicate, no matter where they are. This matters most if the patient is not going to make it.
In Catalonia, there are 27,000 infected patients and over 3,000 deaths, but these numbers climb up to 135,000 and 13,000 respectively across Spain.
Authorities in Afghanistan have warned citizens about increased crackdowns to enforce quarantine measures. In the city of Kabul, residents have been advised to stay indoors or face being fined. The capital was put under lockdown on March 28th, but as in other places, many citizens cannot afford to stay at home for extended periods of time. Afghanistan has so far reported just under 400 infections, with nearly 3,000 more suspected cases. And Germany has unveiled an app designed for smartwatches and fitness bracelets that would allow to collect data that could reveal signs of a COVID-19 infection. However, scientists have warned that the app is only a complementary equipment and does not replace a test.
Today I would like to introduce another app, a new one that has been developed in the last weeks, the Corona Data Donation app. With this app, you can voluntarily provide the Robert Koch Institute with certain data, and thus helps to better estimate where and how fast COVID-19 is spreading in Germany. What you need is a smartwatch or a fitness bracelet and the Corona Data Donation app, which is available for free download starting today.
And with that, we end our news brief, but you can find all of our stories on our website, telesurenglish.net. And be sure to find us on social media. For Telesur English, I'm Carla Gonzalez. Thank you for watching.